Good afternoon, everyone. My name is Megan King. I am a public health educator with the Washington Poison Center. So we are into our second week of the Overdose Prevention, Treatment, and Harm Reduction series. I encourage all of you to head to our website or our Facebook page or YouTube page to catch any of the recordings of what you might have missed last week, as well as to sign up for all of the amazing sessions that we have to offer this week. So today I am so thrilled to introduce one of my colleagues. She is a fantastic pharmacist in our call center. So this is Stephanie Garland. Thank you, Stephanie, for joining us. How are you doing today?
Yeah, happy to be here.
Great. We're hopefully going to have another pharmacist join us any minute, fingers crossed. But if not, then Stephanie and I will cover it today. But before we dive into our topics for this afternoon, I wanted to go through some quick housekeeping for you all. So I have questions prepared for Stephanie, but we would love to hear from you all as well. So please comment with any questions that you have on Facebook or YouTube, whatever platform you're watching on today. And if Stephanie and I don't get to it live, then we will be sure to address your questions after the stream ends. So today we are here to discuss adolescent intentional exposures. I want to provide a little bit of a content warning first. So discussing adolescent intentional use really requires us to talk about self-harm and suicide, and we're going to dive into both of those topics today. So we understand if this is triggering for some, and if you need to close the stream, please do whatever is best for you. For those who remain on, we're going to position the Poison Center a little bit before we dive into our data and our discussion points. So Stephanie, can you tell us a little bit about the role that you have at the Poison Center?
Yeah, so I'm one of the pharmacists, and I spend half my time on the phones, and the other half I'm more of on the supervisor role. But whenever you call into the Poison Center, we are all pharmacists and nurses that answer the phone. We have additional training in toxicology, and we provide immediate free service regarding hazardous substances, poisons, medications, household cleaners, and then also we can also provide some basic medical information or drug interaction information. So it doesn't have to be an emergency to give us a call. We're there 24 hours a day at your fingertips. Happy to help.
Awesome, thank you. And I just want to add too that if English is not your preferred language, then we also have access to an interpretation line in over 260 languages. So people oftentimes think of us as resources for people who have had an accident with something that might be harmful. So a little kid got into something when their parent wasn't looking, or an adult, they accidentally took a sip of a chemical thinking that it was their glass of water. So those calls about accidents or unintentional exposures, they make up a pretty significant portion of our calls. But for adolescents, some of the top reasons for calling us are actually intentional. So I'm going to put up a graph here for you all to look at. And this graph shows the number of adolescent patients that we helped in the first 6 months of this year, so the first 6 months of 2021, with intentional exposures. So Stephanie, can you just walk us through what these different intentional exposure reasons are and how you determine what that reason is when you talk to someone on the phone?
Absolutely. I think the most straightforward is probably the intentional abuse. And this is when people are using a substance to get either high or a pleasurable effect, euphoria, or even maybe a sedative type effect. So these are intentional abuse. They're using it in an inappropriate way to get certain effects. And to contrast that, we also have intentional misuse. And this is more of a situation where it's like a dare. I dare you to eat this soap or this laundry pod. Those are situations where they know it's not appropriate to do, but they're doing it anyway. However, they're not doing it for a specific effect like an abuse situation would. The intentional misuse also covers a situation where, for example, if someone were to know that they should only take one pill of a medication to treat their headache or whatever, but they thought, well, if one's good, 4 is better, that would also be an intentional misuse situation. So they weren't necessarily using it to get high or to abuse the substance. They were using it in a super therapeutic way or to get a better effect out of it. So more help for whatever their ailment would be. And then there's the one that is the most prominent and most common one that we see with teenagers, and that's the self-harm. And that's not only encompasses actual ingestions or exposures that has to do with one wanting to commit suicide, but it also encompasses those situations where someone is using a substance out of emotional intent to get a reaction or a cry for help. So it doesn't have to be a full-blown suicide attempt. It just is along those lines. But we consider all of those intentional self-harm, and then it also includes the suicide aspect.
Great. Thank you for going into all of that detail. So when we're looking at this data, it's both heartbreaking and probably surprising for people too. I think a lot of times people assume that intentional exposures in teens are mostly going to be due to abuse, so that intent to feel intoxicated. But we see in our data that that's not actually the case for us. So Stephanie, can you tell us a little bit about this breakdown of calls? What are you hearing about from teens?
Yeah, so it really was a shock that the self-harm intent was so much higher. I wasn't surprised about the abuse being on the lower end. I was a little surprised that misuse was even more than abuse. So there's more adolescents doing a dare versus trying to get high, which I thought was very interesting, because just the perception in the media, and I feel like the word on the street and even in the community, is that teenagers are doing things to get high, but that's not really what we're seeing. And then the self-harm, that's something that we've noticed. And when you're on the phones, you can feel like you're getting more calls in a certain area, but when you look at the data, it may not match exactly what you feel. And this was a case where I felt like we had been getting more self-harm calls, but when I saw the numbers, I was blown away at the discrepancy and the amount of self-harm adolescent calls we were getting.
And it looks like, oh, we have Trent joining here. Here we go. Hi, Trent.
Hello, I'm very sorry that I'm late. I was confused about what time we were starting.
Not a problem at all. So everyone, this is Trent. He is another one of our pharmacists in our call center. So Trent, we just went through the breakdown of intentional exposures that we've had so far in 2021. So Stephanie, I think you were just about to talk about the age of these.
Yeah. And that's something that whenever we break it down, we usually have, when it comes to adolescent and pediatric exposures, we usually do under 6, which was not something we looked at in this scenario. It just didn't apply. But then we also do 6 to 12, and then we break it down further, 13 to 17. So you get kind of those preteen years and then those teenage years. And the amount of the 6 to 12-year-olds that are now having self-harm attempts has drastically increased. We've seen an increase in the 13 to 17, but it hasn't been as intense of an increase. The 6 to 12 years old from 2020, those first 6 months during that time frame, to 2021, the first 6 months that we've had, there was a 59% increase in that 6 to 12-year-old self-harm attempt range, which was, I think that's the most outstanding thing that we saw in this whole data set, in my opinion.
Yeah, that is just so sad. It's so young. So we're going to come back to these self-harm and suspected suicide cases in just a minute, but I did want us to talk a little bit more about intentional abuse and misuse cases. So Trent, now that you're on, can you tell us about the common calls you're receiving about teen intentional abuse and misuse, and what substances are commonly involved in those cases?
Of course, yeah. So with teens, commonly, because prescription drugs are often less accessible to them, Abuse cases, intentional misuse, are often involving over-the-counter drugs, such as certain cough and cold medicines that can contain drugs that are known to cause a high. Sometimes they're just liquid drug formulations that actually have alcohol in it, and the purpose is just to get drunk using that. And other cases that we receive calls about, sometimes it's just a teen experimenting with alcohol for the first time, just a regular alcoholic beverage. Less commonly, but occasionally we do also receive calls about substances like hallucinogenic mushrooms that they're able to get their hands on sometimes. A lot of times that's from a concerned parent, just kind of concerned about how to approach getting their child through this experience if they're not having a good time with it. Misuse cases often involve taking an increased dose of a prescribed medication or an over-the-counter medication, trying to improve the effect of it. Common example would be students studying for exams, trying to stay up all night, trying to focus better, maybe taking way too much caffeine with coffee or energy drinks. Potentially, if they have a prescription for a medication such as an ADD medication, they might take an extra dose or two of that to try to enhance their ability to focus. So those are a couple examples that I received of misuse cases.
Great, thank you. So that's an important point to be making about the over-the-counters and their readily available medications, those prescribed medications that they're using in these misuse cases. And so, Stephanie, I know that it's a similar trend for self-harm and suspected suicide. So can you tell us a little bit more about this? What are the common substances? Why do you think these are the common substances?
Absolutely. So the majority of the adolescent intentional exposures involve over-the-counter medications and prescriptions that belong to people in their family. It's common for a household to keep a bottle of Tylenol or ibuprofen around. And so it's all about access. It often happens with things that you have quick access to. Most of the time, it's a spur of the moment, knee-jerk reaction rather than something that's been carefully planned. And so the medications that are right there in the home, that know where they are in the cabinet, those are the things that we see most often. And it's the same for even adults and infants. People are exposed to things that they're commonly around. We get a lot of calls on infants with diaper cream exposures because infants are often around diaper cream. Adults, same thing, commonly exposed to things that they have easy access to, their own medications, over-the-counter medications. So it's all about whatever's near you is likely going to be the thing to grab.
Great, thanks. And I think that point you made about how sometimes it can be an impulse decision is really important to emphasize, because that's what makes safe storage such an important strategy to prevent these self-harm and suicide cases, because just that extra barrier to accessing those easily accessible medications can be really helpful in preventing these cases from occurring. Okay, so we're going to put another graph up for now, and this is showing adolescent self-harm and suspected suicide cases in this last year broken down by gender. So Trent, can you tell us what we're looking at and what stands out to you with this data?
Yeah, so what we're looking at here is basically two different categories here, 2020, 2021. Each of those represents the first 6 months of the year, so January 1st through January 30th. On the left, we have the number of self-harm, suspected suicide cases by gender. So in 2020, from January to the end of June, we had 206 male patients and 843 male patients with a reported suspected suicide or self-harm exposure. Compared to this year in 2021, between January and the end of June, we had 204 males and 1,194 females. So basically what we appear to be seeing here is a really disproportionate increase in the female cases that are being reported to us. And I couldn't really conjecture as to why that might be, but it does seem to be a significant increase as compared to what we're seeing with males, which is not really a significant change statistically.
Yeah, it's pretty shocking how quickly or how much those female exposures increased. And I know that that's being reflected nationally as well. It's not just happening here in Washington. So I wanted to take a step back now to consider all of the intentional calls that we're getting from teens. So Stephanie, can you tell us about who is calling you with these exposures?
Absolutely. So we get calls from pretty much everyone, the parents, siblings, friends, and the patients themselves. They call for advice on how to manage whatever situation they have at hand. Oftentimes, people that are abusing substances won't want to give a lot of details, or maybe aren't able to give a lot of details because their perception or functioning is impaired. So we have to be creative on how we ask certain questions because, for example, asking, well, when did you take this? They may not be able to reasonably judge a span of time. So asking, well, was it still light outside? Was it before school, after school? So getting a little bit creative with how we ask things and how to gather information can be helpful. And then also whenever friends call, they may be hesitant to provide a lot of data or a lot of information regarding what exactly happened. They don't want to get in trouble. They don't want to get their friend in trouble. They don't really know what to do. And so it can be difficult, particularly when speaking to a teenage friend. They're worried about whoever it is they're calling regarding. And so building that trust, and then also letting them know that we're not a reporting agency, that all of the information we're given is confidential. We're here to support and to help out the best we can in a healthcare setting rather than any type of reporting agency. And then I've been surprised at how often the adolescent that has ingested out of self-harm actually gives us a call themselves. And that can be a very emotionally sensitive call that they may be scared to wake up their parents and tell them they need to go to the hospital. And so it's a very delicate situation. And that's one of those things that's increasing more and more. I'm glad they're calling, though, don't get me wrong, but it's a very difficult situation, and I wish we knew better how to prevent that from ever coming up.
So you just started to briefly touch on trends that you're seeing or changes over time. So I wanted to ask this question to both of you of just what changes you've both noticed about the nature of these cases throughout the pandemic. I know we see in our data how things have changed, but you're actually answering the calls. So yeah, Trent, let's start with you.
Yeah, not to belabor the point, but basically there have just been a lot more cases in general that we've been seeing. It seems like so many of the calls that we're answering are cases that fit these descriptions of intentional overdoses with the intent to harm themselves. And it's really sad. I mean, I'm glad that we're getting the calls about them so that we can help out in these situations, but it does seem like compared to prior to the pandemic, the frequency of these cases is just really, really taking off.
Stephanie, what about you?
Yeah, so at the start of the pandemic, there was something I noticed that I thought was very peculiar and interesting, and it was a lot of calls regarding misuse of cleaning products. Part of it was that they were using products they had never used before because availability of their trusty go-to wasn't on the shelf. And so they had mishaps because they were using a product that they just didn't know how to use and maybe didn't read the instructions and used it how they had use their previous product. And I thought that was very interesting. And it wasn't just adults, it was a lot of this adolescent group that was calling us regarding exposures they've had that they misused the product and they wanted to know what to do and how to remedy it, which I thought was fantastic. Those calls I feel like have subsided somewhat, that was more of an initial pandemic response. And maybe in the last 6 months, those have kind of gone back to baseline. But definitely over the past 6 months, we've seen that increase in the self-harm attempts, where it's no longer the intentional misuse doing a dare. It's not as much of the abuse, but really the intentional self-harms.
Great. Thank you both for walking us through all of that. So I'd like to end this stream with a set of questions that we've been asking every single one of our panelists over this last week. So first, after listening to you here today and engaging in other sessions during the series, what is one action step that you would like to see people take? Trent, let's start with you.
Yeah, I mean, I'd really like to see people take a more active interest in what kind of products around their houses, medications, etc., have the potential to be seriously harmful. And you know, that people can always call us and ask questions about these types of things. We don't have to answer calls that are just about an exposure. We can provide information about specific products and say this is going to be on the dangerous side of things. This one, you maybe don't need to lock this up, but still keep a close eye on it. That type of thing. And as far as, you know, medications too, it's a really good idea to take those seriously. Take into account how often you're using it. Make sure that you're keeping track of how much is remaining in case something were to happen. And another thing that we are able to provide are Mr. Yuck stickers. If anybody out there remembers those, we are happy to send those out. Give us a call and we can mail you a pack of them, and then you can label items in your house to make sure. There we go, exactly. I love how bright and neon green they are. So you can use those to label anything in your house that you want to ensure that is being taken extra seriously.
Great, thank you, Trent. Stephanie?
Call the Poison Center. We'll let you know if something is safe to keep at home or whether you need to go to the hospital. And if you do need to seek additional medical attention, we'll walk you through the steps of what you need to do. And should you need to go to the hospital, we'll even call the hospital ahead of time, let them know what's going on. That way they're prepared for you when you get there.
Perfect. Nice and simple. So we have engaged in a lot of hard topics today, obviously. So I want to round us out on a positive note. Can you share with us what brings you hope in your work? So Stephanie, we'll start with you first this time.
I alluded to this a little bit earlier, but I am so impressed with the teenagers that are calling regarding the cleaning products or mishaps or because they're worried about a friend. I'm so impressed that they are able to know who to dial, have the guts to make that phone call, because making phone calls is not always the most comfortable, particularly for younger folks. But it's impressive that I can get a teenager that got a substance in their eye, and I can walk them through how to irrigate the eye and then tell them to call me back in an hour, and they're able to do all these steps. I'm just so impressed because I don't know that, you know, as an adolescent, I would have been able to do that. So that gives me hope that they're able to use their resources, they're able to use them appropriately and follow up even.
That's great. Yeah, I also don't think I, as a teenager, would have really been able to call the poison helpline and to have that experience just one-on-one with you. So that's wonderful. So I'm not seeing any comments come through with questions. We have about a minute left if folks do. In the interim, I encourage you all to click the link there that we just put in the comment section on how to access the rest of the sessions for the remainder of the series. It goes through the end of this week. We will have one more session on these adolescent exposures. And we're going to specifically look at the self-harm and suspected suicide cases. So that will be a 60-minute long session featuring one of our call center pharmacists as well as a mental health therapist from Seattle Children's. And they will discuss the trends that they're seeing as well as the process for what happens when someone either calls us with one of these exposures or if they go into the emergency room. So I encourage you to join that session and learn more about our data, about what we're seeing and what the emergency departments are seeing. We do have one question that just came through. What are you finding about opioids, mainly fentanyl? And I'm going to assume that applies to more than just adolescents.
Yeah, so we're not seeing as much of an increase as one may expect. Over the past year, we have not even gotten a dozen cases. So it's still pretty low on the exposure radar. I mean, we're watching for it, but we're not seeing nearly the increase as in the news. Now, that may be that it's out there and just those people aren't giving us a call, or maybe that they're having more severe symptoms and there's a tragic event that happens because of the fentanyl and we're just not in the loop because the situation's too late for us to be able to help out. But as far as fentanyl, it's something highly on our radar, but we're not seeing a huge increase as of yet.
Great, thank you.
Yeah,
Trent, did you have anything to add? Yep.
Yeah, we don't receive a whole lot of calls about it. Clearly, it's still out there, and it seems to be. I mean, from reading the news, looking at the data there, it's getting worse and worse and worse. We do occasionally receive calls about street drugs that are contaminated with it, so that's something that we always try to be vigilant about. If we receive a report of someone who has been abusing street drugs, we make sure to give advice about how to manage just in case there were fentanyl involved. But yeah, I do think a lot of the times there's just such a high volume of opioid fentanyl overdoses. We don't receive calls about all of them. A lot of times folks are not found until it's too late. So it's a really terrible thing. But as far as our data reflects, there hasn't been a whole lot of additional reporting to us on these.
Great. Thank you both for that. I'm not seeing any additional questions. If any viewers have questions after the fact, you're welcome to leave a comment and we will try to address it later on. Otherwise, thank you, Stephanie and Trent, so much for joining us here today. Really value your insights into all the data that we shared and sharing your stories from the call center. So I think that's everything for today. And I hope to see all of you viewers in future sessions. And thank you very much.